And welcome back. In today's medical moment, while other headlines like inflation and Ukraine dominate the news cycle, others like the opioid crisis aren't as prevalent. But that doesn't mean the crisis itself isn't still prevalent. The disease of addiction is still with us, and there are those that dedicate their lives to helping those suffering from addiction manage it and sometimes even break it. Kate Behrenwald from Spectrum Health joins us this morning to tell us more about services being offered in the area. Good morning. How are you? Thanks for joining us.
I'm doing well, Todd. How are you?
I'm well, thank you. The opioid crisis, boy, we heard it was just everywhere for the past couple of years in the news cycle. We don't hear about it as often, but as I mentioned, the crisis here in the U.S. and here in Michigan, still here. Is there a way to track cases in our area?
There is. Actually, the Michigan Department of Health and Human Services has a very interactive dashboard on michigan.gov, and that's looking at state information as well as county-based data. You could select Kent County, for example, and be able to see everything in terms of ERs, overdoses, et cetera, and that's pretty up-to-date information.
Kate, when I was looking at these, I'm looking at a color-coded map right now that has cases of opioid deaths and things, and I was noticing that I do believe, and correct me if I'm wrong here, that the red, which isn't the greatest, also included Kent County.
It does, very much so. Unfortunately, there's a large amount of the United States where overdose rate is high, but access to treatment is quite low.
That is something obviously we want to address, access to treatment. And that's what we're here to talk about, really. You're expanding services to the Greenville area. What sort of services are going to be offered at the new Greenville clinic?
So the Center for Integrative Medicine Greenville location will reflect what we do here in Grand Rapids. That's a comprehensive substance use disorder treatment, primarily focusing on opioids, but also with a heavy focus on alcohol use disorder and stimulant use.
So it basically is going to cover some of the major types of addiction that are out there. What type of patients can you treat? Are there any limits?
We see people 13 and over, and we take most insurances.
So anyone 13 and over, and of course, insurance can cover a lot of this. What about appointments? Is there an emergency? Can we just drive up if there's an emergency, or do I have to have an appointment?
Appointments are preferable. The clinic is open on Fridays, but it is walk-in access. Having an appointment would reduce your wait time, but we still want people to be able to have the lowest barrier care possible within the Friday workday. So it's able to be as a walk-in access too.
Absolutely. That's important to be able to have that service ready and willing when it's needed. We talked a little bit, I'm sure, about this at the top of the interview with the need, but why expand this service to Greenville? Is there an extraordinary need there, or are we just building and growing?
So great question. Some of it's building and growing, but honestly, Spectrum Health recognizes a lot of the communities surrounding the Grand Rapids area don't have good access to care, especially specialty care. When we were looking at where we would place a satellite location, we relied on the data. So Spectrum Health found data that the Greenville ER saw almost as many overdose-related concerns as the downtown ER did. When you add that with the rate of opioid overdose and Hep C rates, it made good sense to go there.
That's an astonishing statistic that you just laid out there. That area would have that many as compared to a bustling downtown area. So obviously a need in the area. Let's get more information to those who need it. If someone knows of someone, or maybe it's themselves that are struggling with addiction, how do people get a hold of you?
I would say that the best phone number to contact initially would be the downtown main number. So that's 616-391-6120.
All right, pick up that phone, make that call if this is something you need, and kudos to Spectrum meeting the need where it's needed most. Appreciate it. And of course, spectrumhealth.org. Kate, thank you so much for the time this morning.
Thanks, Todd. Have a nice day.
Absolutely. You too. Again, spectrumhealth.org for more information. We'll be right back.